Hello and welcome to Neurology, a channel dedicated to biology or the study of life. Have you ever considered the complex neural pathways that allow you to taste your favorite food, feel pain when you accidentally bite your tongue, or experience the burning sensation from a hot drink? Or how does your tongue seamlessly coordinate movements? All of these functions rely on a precisely organized network of cranial nerves. In this video, we'll break down the innervation of the tongue, making it easier to understand and remember. This is essential knowledge for those preparing for entrance exams. Let's get started. The nerve supply to the tongue comes from multiple cranial nerves, including the mandibular nerve, which is the third division of cranial nerve 5, facial nerve, which is CN7, glossopharyngeal nerve, CN9, vagus nerve, CN10, hypoglossal nerve, CN12. I know remembering all of these nerves can feel overwhelming, but don't worry. In this video, we'll break it down using a simple mnemonic and a table to help you understand and remember it easily. Now for this, we need to first split the tongue into two parts. The anterior 2/3, which is the front part of the tongue, and posterior 1/3, which is the back part of the tongue or the root. And function-wise into three parts: taste, general sensation, that is touch, pain, temperature, etc., and motor. So taste and general sensation are taken care by the sensory nerves, while movement is through the motor nerves. Let's first look at the anterior 2/3 of the tongue. You can see there is this 2 here. So the front 2/3 of the tongue are supplied by two different nerves. How do you remember this? Now take A from anterior, flip it upside down, it looks like a V. Now take this 2 and put it into the V in Roman numerals 7 is what you get, which is the cranial nerve 7 responsible for taste for the anterior part of the tongue. Cranial nerve 7 is the facial nerve via chorda tympani. Then move this 3 in next to the V, forming 5, 3. That is basically the third division of the cranial nerve 5 for general sensation, that is touch, pain, temperature for the anterior part or the anterior 2/3 of the tongue. This is the mandibular division of the trigeminal nerve, cranial nerve 5, via the lingual nerve branch. So for those who have got confused with this, let me briefly explain. The cranial nerve 5, which is the trigeminal nerve, has three main divisions. The third is the mandibular. That is why we write 3 after the Roman 5. Out of 4 or 5 branches of the mandibular division, one important branch is the lingual nerve. So the lingual nerve branch of the mandibular division of the trigeminal nerve provides general sensation, that is touch, pain, temperature, to the anterior 2/3 of the tongue. Hope this is clear now. Now let's look at the posterior 1/3 of the tongue. 1/3, take that 1 and remember that there is only one nerve which supports the posterior part of the tongue. So the back third of the tongue is innervated by only one nerve. So take this letter P from posterior and flip it around. It looks like 9. That helps you remember cranial nerve 9, which is responsible for this region. Cranial nerve 9 is glossopharyngeal nerve, and it provides both sensory, that is touch, pain, temperature, and taste to the posterior third of the tongue, right? Now for the motor control, that is the tongue movement. For the entire tongue, there is only one nerve. To remember it, add this 7 plus 5, which makes it 12. So almost all the tongue muscles, extrinsic and intrinsic, are controlled by the cranial nerve 12, which is the hypoglossal nerve. The only exception to this is the palatoglossus muscle, which is controlled by cranial nerve 10, which is the vagus nerve. Now with this mnemonic and breakdown, remembering tongue innervation should be much more easier. Now how does your tongue nerves work in real life? So every time you eat, drink, or accidentally hurt your tongue, different nerves help you feel and taste what's happening. And here's how that works. Now biting the front of your tongue, its trigeminal nerve which tells your brain, ouch, that hurt. If you burnt the back of your tongue with hot tea, it is the glossopharyngeal nerve, which is cranial nerve 9, which is responsible for feeling pain in the back part of the tongue. If you're tasting sweet, salty, or sour food, it is the cauda tympani, the branch of the facial nerve CN7, which helps you enjoy flavors like candy, chips, and lemonade. Why does black coffee taste so bitter? It is again glossopharyngeal nerve, that is the cranial nerve 9, which detects bitter flavors, making sure you know that your coffee is strong. And why don't you choke on food? That's because of vagus nerve, which is cranial nerve 10, which helps to control the very back of your tongue and throat, stopping food from going down the wrong way. So whether you're enjoying your favorite snack or feeling the burn of hot food, these nerves are always working behind the scenes. Now, from a clinical perspective, why is this tongue innervation so important? That's because the tongue nerves serve three main functions: talking, that is speech, tasting food, and swallowing. So, if these nerves get damaged, it can lead to serious medical problems such as bulbar palsy or pseudobulbar palsy, where there are problems with swallowing and speaking, or Bell's palsy, where there is weakness in facial muscles affecting taste, or it could be glossopharyngeal neuralgia, which is a sharp pain in the back of the throat and tongue. So, doctors like neurologists and ENT specialists check for these problems to diagnose and treat them early. And with that, we have come to the end of this video, which is the third in our part 5 series on tongue. In the first two videos, we covered structure and anatomy of the tongue, different types of papillae and the sense of taste. And in this video, we have looked at the innervation. So what's coming next is the muscles of the tongue and blood supply, lymphatics and glands. So stay tuned for the next two videos and don't forget to subscribe so you will be the first to get notified when the video drops. Until then, keep watching Neurology. See you in the next video.